Dr. Beverly Spivey, and I am the Chronic Care Medical Director for Carolina Collaborative Community Care, and I want to talk to you today about the MOST form. This is a MOST form. MOST stands for Medical Orders for Scope of Treatment. Why should you have a MOST form? Suppose you got really sick. You would want people to do things that you want them to do. You want to have some control over what is done to you and not let other people make the decision because they might not make the decision that you want. This gives you the opportunity to let people know what you want if you were so sick that you couldn't tell them yourself. So we recommend that you have a MOST form or something like it. There are other forms. They're all called advance directives. They tell people in advance the directions for how to take care of you. Other types of advance directives are living will, healthcare power of attorney. These are different documents that you can use, but you should have some kind of document. We're talking about this one because it's a simple one-page form. This form asks 4 questions. First, it asks, do you want CPR, cardiopulmonary resuscitation? Suppose you got so sick that you stopped breathing and your heart stopped beating. Would you want them to pump on your chest and breathe for you? So the question is yes or no, if you would want that or if you don't. The second question is medical intervention. If you stop breathing or your heart stopped beating, would you want machines to keep you going? A breathing machine, a heart beating machine. Would you want these things used? Or would you just want medical treatment, medications and things like that? Or would you just want comfort treatment? That's the second question. The third question refers to antibiotics. If you had an infection, would you want antibiotics? Would you want no antibiotics? Or would you want them to be tried for a little while to see if they will help you? And the fourth question concerns food and liquids. Suppose you could not eat or drink. Would you want tubes put in your throat or your neck or your stomach to provide you with food and liquids? Or would you like no interventions like that? Don't do that to me. Or would you want it tried for a limited period of time to see if it would help? These are the 4 questions asked by the MOST form. The MOST form is a medical order, a doctor's order. And so you and your doctor need to discuss this, and both you and the doctor need to sign this. And once a year, you can review to see if you still want the same instructions. And if you want to make changes, you can make changes at once a year intervals or at any time. Everyone needs to have an advance directive because you never know when you might be in a situation where other people need to know what you want. And you want to be able to tell them what you want. So I strongly recommend that you consider the MOST form or something like it. And share this with your doctor, with your family, because they'll be the ones that have to carry out these informations, and anyone else who might be involved in your care. I thank you. If you have any questions, please feel free to contact us at Carolina Collaborative Community Care. Our phone number is 485-1250. And you can ask for me, Dr. Beverly Spivey, or anyone at the Carolina Collaborative Community Care office. We'd be happy to help you. Thank you.